can you stop taking your blood pressure pill? It's a question that comes up a lot, isn't it?
Oh, absolutely.
You've been on medication, maybe feeling good, your numbers are looking better, and you naturally start wondering, is this like a forever thing?
Hmm.
So we're doing this deep dive specifically because a listener sent us some material. They really wanted to understand the whole journey, the factors, the risks involved, and, well, how you might even think about approaching that question.
Right. And the source material we're looking at today, it gives us a pretty clear medical perspective on this whole issue.
Okay.
It walks through, how high blood pressure tends to develop, what the medication's actually doing, and it puts a huge emphasis on lifestyle changes. Really big.
Okay.
So our mission here really is to unpack all that information for you. We want to help you see what conditions, if any, this source suggests might make stopping medication a possibility, what are the crucial steps, and critically, why medical guidance throughout any kind of change like this is just, well, it's non-negotiable.
Right. This isn't medical advice we're giving.
No, absolutely not. We're just exploring what the information in the source tells us.
Okay, perfect. So let's unpack it. Where do we even start to get our heads around this possibility of coming off medication?
Well, you really have to begin with how high blood pressure develops in the first place.
Mm-hmm.
This material makes it quite clear it's not usually like catching a cold, overnight.
It creeps up on you.
Yeah, it's typically a gradual process. It unfolds over time.
And the source really stresses the importance of regular home blood pressure monitoring, doesn't it?
Yeah.
It's not just about that one reading.
Exactly. That's key. It's about the pattern. And the source gives us some specific numbers for home readings to kind of use as a guidepost. 135 for the systolic, that's the top number,
Okay.
and 85 for the diastolic, the bottom one.
And it makes a really important distinction here, too. Like, seeing one high reading, maybe it jumps to 140 over 90,
Yep.
or even 150 sometimes. That doesn't automatically mean you have hypertension. The material points out that could just be temporary, maybe stress, pain, an infection, even other meds you're taking.
Precisely. The real signal, according to this, is a tendency, a consistent pattern, where your readings are staying above that 135 over 85 range over a period of time.
Okay.
That consistent trend, day after day, week after week, that's when the picture of potential hypertension really starts to come into focus.
Right. So let's say you've gone through that, you've been diagnosed, and you started medication. The source mentions common ones: losartan, amlodipine, valsartan, things like that.
Mhm.
What's the main job of that medication then, according to this material?
Well, its role is pretty direct. It's there to take those elevated numbers, bring them down into a healthier range, and then, crucially, keep them there. Keep them controlled.
Okay, so the med's doing its job, pressure's under control now, but then comes the big question our listener and probably lots of people have: what happens if you just stop taking the pill?
Yeah, the million-dollar question. And based on this material, the most straightforward, logical expectation is that your blood pressure will probably go right back up.
Okay, that makes sense.
And the really crucial insight here is why. It's because the underlying factors, the things that cause the pressure to be high in the first place, they likely haven't changed just because you started a pill. They're still there.
Ah, right.
And this leads to a key idea the source really encourages. It talks about doing an examination of conscience, or maybe think of it like a personal checklist
A checklist.
of the lifestyle factors that were probably playing a role back when you were first diagnosed.
Okay, so what kinds of things are on that checklist the source mentions?
Well, it lists things like maybe eating too much in general, getting too much salt, or using lots of condiments, maybe too much fast food or processed food.
Right.
Weight gain is a big one, issues with blood sugar control, smoking, regular alcohol use, and just being sedentary, not moving enough.
That covers a lot of ground.
It does. And there's a great analogy used in the material here. It says the medication is kind of like putting out the immediate fire.
Okay.
It deals with the symptom, the high number, but the real fundamental work, the long-term solution, is about addressing those underlying causes. It's about, working on yourself, tackling those items on the checklist.
So let's follow that thread. During the time you've been taking the medication, let's say you've also been actively working on those things. Maybe you've lost some weight, really cut back on salt, got your sugar levels more stable, started exercising regularly. What might you start to see happening with your blood pressure readings even while you're still taking the same medicine?
Yeah, this is where it gets really interesting, according to the source. It points out that even while you're still on your medication, You might start noticing your pressure readings are consistently lower than they used to be.
Lower than the target, even.
Sometimes, yeah. Like maybe you're regularly seeing 115/70, when your typical controlled reading on that same dose used to be more like 130/80.
Wow, okay.
And the reason, the source explains, is that these lifestyle changes, they effectively start acting like pills themselves. Their positive impact builds up over weeks and months.
So they're adding to the effect of the actual pill.
Exactly. Now, if you're consistently seeing these significantly lower readings while still on your medication, and you know you've been putting in the work making those lifestyle changes,
Right.
that's the point where, according to this material, it might actually be appropriate to start a conversation with your doctor about potentially reducing or even stopping the medication.
Okay, so this is the moment the listener was asking about. You've seen the lower numbers consistently. You've genuinely made changes. How does the source suggest you actually approach this? Can you just like wake up one morning and decide, okay, no more pills?
Absolutely not.
No.
This is a point the source is incredibly firm on. Any change must happen with medical follow-up under strict control. It's framed very much as a trial period, not a sudden stop.
A trial period. Okay, how does that usually work based on this?
Well, the typical process described involves starting cautiously, maybe reducing the dose first, perhaps literally cutting the pill in half, if that's feasible and okayed by the doctor.
Right.
Then you monitor your blood pressure really closely at home, maybe for a week or so. If it stays well within your target range on that lower dose,
Okay.
then you might discuss with your doctor about reducing further or potentially stopping entirely, especially if you were only on a low dose or just a single medication to begin with.
Got it. And the source mentions that fear people have, right? What if I cut the dose and my pressure just shoots straight back up?
It does address that. It offers some reassurance that if you've genuinely put in the hard work on those lifestyle changes, that kind of sudden, dangerous spike is actually less likely during a properly supervised trial.
Less likely than if you just stopped without doing anything else.
Exactly.
Yeah.
It contrasts the supervised approach with just stopping cold turkey without making any lifestyle changes. That, the source indicates, carries a significantly higher risk of the pressure rebounding, sometimes quite quickly.
Okay, that distinction is really important.
Very. So let's say you go through this careful, gradual, medically supervised trial, and your blood pressure consistently stays within the target range without needing the medication for a certain period. The source mentions checking after about a week off the pills as a potential milestone.
Right.
You may have achieved something the source calls remission.
Remission. That sounds significant. What does that mean in this context exactly?
It essentially means you are successfully controlling your blood pressure using non-pharmacological methods, basically through your consistent lifestyle habits, diet, your exercise, weight management, all those things we talked about.
Okay.
The source acknowledges these are often the hardest things to do consistently over the long haul, but it also emphasizes they are the most impactful long term.
Right. The pill is easier, maybe, but this is more fundamental. Are there factors that make achieving this remission, this control without meds, more or less likely for someone, based on the source?
Yes, it does point to several key things to consider. Age is one factor. Younger individuals, generally speaking, are seen as more likely to achieve this kind of control without medication.
Why is that?
Well, part of it is related to arteries naturally becoming a bit less flexible over time as we age, but it stresses that older people absolutely can still succeed too.
Okay, good. What else?
Another factor is the severity of the hypertension you started with. Often that's indicated by how many different blood pressure medications you needed. If you were on, say, 4 or 5 different pills,
Yeah.
it suggests the hypertension was quite significant. Achieving complete remission, stopping all of those pills might be less probable, but even significantly reducing the number of pills or the dosages is still a huge win, a really positive step.
Absolutely. Any other major factors?
Yes, and this one's really important. Other health conditions. The source prompts you to ask, do you also have diabetes, kidney problems, heart issues, other related conditions?
Oh, okay. Why does that matter so much here?
Because sometimes the blood pressure medication might be doing more than just lowering your pressure numbers. It could also be providing crucial protection for those other organs, your kidneys, your heart.
I see.
So in those cases, even if your lifestyle changes bring your blood pressure numbers down perfectly, stopping the medication might still not be advisable because you'd lose those other protective benefits. That's a critical discussion to have with your doctor.
That makes total sense. So, okay, Let's imagine someone has successfully achieved remission through all this hard work and careful medical supervision. Does the source suggest they're now, like, cured? Can they relax and maybe go back to some old habits?
No, absolutely not. The material is crystal clear on this point, maybe the most critical takeaway, actually.
Okay.
Achieving remission through lifestyle is a massive accomplishment. It really is. But it requires ongoing vigilance. It's not a one-and-done thing.
So what does that mean, ongoing vigilance?
It means you must continue monitoring your blood pressure regularly at home. You need to keep up with necessary lab tests, whatever your doctor recommends. And crucially, you need to keep attending your doctor's appointments for checkups. That follow-up is paramount.
Why is that continued effort so vital if your pressure is currently fine without meds?
Because, as the source warns quite directly, if you stop taking care of those lifestyle factors that got you there, if you slip back into old habits, the switch can be turned back on, as they put it.
Ah.
Your blood pressure can start creeping back up, and you might find yourself needing to go back on medication again.
Yeah.
It requires sustained effort.
Okay, so really, listening to all this from the source material, the possibility of stopping blood pressure medication, it's not about finding some magic loophole or just deciding one day you're finished with it.
Not at all.
It's presented much more as a potential outcome, right? An outcome of serious, sustained lifestyle changes, and something that can only be explored safely with careful medical guidance and supervision all along the way.
Exactly. It really reframes the whole thing. It suggests that getting blood pressure under control for the long haul might be less about relying solely on the pill and much more about building those foundational healthy habits.
Habits that benefit your whole system, too, not just the blood pressure number itself.
Precisely. Better heart health, better metabolic health, just overall well-being.
So what does this all boil down to, then? It feels like it means that while medication is clearly a vital tool, an essential tool when needed,
Absolutely.
the actual power to potentially change your long-term health path, maybe even get to a point of controlling pressure without meds, often lies in those consistent, sometimes difficult daily choices you make about your lifestyle.
That's the core message, I think. It's a really powerful reminder that every single decision you make to fight against those things that aren't serving your health, the extra salt, the sedentary evening, whatever it is for you, it truly has a real tangible impact. It adds up.
So thinking about that, if managing blood pressure long-term is so deeply connected to those consistent lifestyle choices, maybe more than the pill itself for some people in the long run, here's a thought to leave you with. What's just one small, genuinely manageable step you could maybe take today? Something to start building or reinforcing one of those lasting, healthy habits.